Hi, I'm Dr. Taylor Pollei. I want to talk for a quick minute about something that comes up regularly with patients, and that is their common fears and concerns when it comes to facial plastic surgery. So again, this is not something that we just do on an average ordinary weekend. This is kind of a big deal. These are surgical procedures with real risks, with real, outcome variability. So I always do my best prior to surgery in the consultation setting to talk to patients, to get to know them as a person, to really understand what their expectations are and where they're coming from. It's really hard to have an awesome surgical outcome when the patient's expectation and my expectation and what can actually be done don't align. So the biggest, most important thing prior to surgery is to really communicate, get to know the patient, and discuss what really our possible outcomes are. With that expectation alignment, I find that's really part one in getting that awesome surgical outcome. When it comes to other things that we talk about, it's usually the risks and the benefits and the alternatives to surgery. In this case, it's specifically, what are we really looking at as far as that kind of risk-benefit ratio? I mean, obviously bleeding, minimal risk but there, infection, minimal risk but there. Anesthesia is one that we often will talk about for quite a bit of time. I personally am pretty particular in how I do my anesthesia. I have a number of hand-picked anesthesiologists from the Hoag Hospital group. They're just amazing anesthesia providers. We utilize a conscious sedation, deep sedation, general anesthesia. I know that might sound a little contradictory, but it really is patient asleep, remembering nothing, but breathing on their own. No breathing tube, no paralysis, unless it's something that we need for, say, a rhinoplasty. But for the vast majority of my cosmetic surgical procedures, brow lifts, eyelids, facelifts, neck lifts, etc., we can have you asleep, but breathing on your own. Therefore, it does decrease the anesthesia risk and makes the recovery a little bit better over those several days as you're recovering. Probably the most important thing to discuss after those are just the overall downtime and how long till you're back in circulation. So usually I'll tell patients there's kind of two components. There's till you feel good enough to do things, and then there's the till you look good enough to be around people in different settings. So kind of working back from the end point, by 6 weeks, almost every surgical patient of mine is ready to go to their niece's wedding or their, brother-in-law's wedding and look good, feel good, and be themselves. Whether that's like a high school reunion or something important or something that they just feel is important, it really just gives them enough time to recover completely. And at about 2 weeks, so prior to that is when I say there's very few activity limitations. They can be exercising, although ease back in based on their kind of activity level and based on how their body lets them and tells them. But really most people by then are getting back to their pre-surgery level of activity. About 1 week is what we usually see for suture removal, especially for eyelids, neck lifts, facelift incisions, rhinoplasty incisions. 1 week is the typical suture removal time, unless there are incisions that have sutures that dissolve, like maybe behind the ear in a facelift or neck lift patient, those dissolve on their own. And that's usually when we're seeing patients really kind of turn the corner. Now those next few days following surgery, obviously we'll see some swelling and some bruising. Patients want to keep their head elevated, keep their head wraps on, ice, etc. And if you can make it through that first day or 2 or 3 and get to that point, you're feeling pretty good. I've never had a patient that came in after the fact and said, oh my gosh, that was the absolute worst. I would not do that again. The vast majority of patients say, okay, it's what I expected. This is surgery, this is real. But my expectations were appropriate. I got through it. I'm glad I did it. I'm gonna send my friend in. She's totally excited to kind of do the same thing. That tends to be the way more common patient experience and outcome that they have.